Hi, I'm Dr. Adrian Lopresti. I'm a clinical psychologist and founder of PI Therapy. In this article, I'm talking about some of the biological causes associated with depression and anxiety. Now, what the research has shown over the last decade is that depression and anxiety are associated with kind of differences or disturbances in several biological processes. It was previously believed that levels of kind of serotonin or neurotransmitters were the primary cause or factors associated with depression. So basically, if you could increase levels of serotonin, you could improve mood. But what the research has confirmed is that it's far more complex than that. It's not just about serotonin or dopamine, it's another neurotransmitter. There's other things that are going on from a biological perspective that we really need to consider, we really need to target. For example, we know that inflammation is higher in people with depression. And if you can reduce inflammation, you can potentially improve mood. Excess free radical damage is also a problem in people with depression. And excess free radical damage over time can cause damage to all our organs, including the brain. There's also increased levels of cortisol or stress hormones in people with depression and anxiety. And again, we've got to find ways to reduce levels of cortisol if we want to improve mood. So it's far more complex than just targeting serotonin. We need to look at all these other different factors that are going on. Now, the way to target these is through an integrative approach. And this integrative approach needs to look at kind of our diet, our sleep, our exercise, our stress levels, because we know all these things can affect all these biological processes. And that's why you're going to hear a lot in PI therapy about targeting and working towards improving mood through multiple approaches rather than just through either psychological therapy or just medication. We've got to look at it from an integrative approach. Now, if you're interested in learning more about PI therapy, be sure to sign up to our free newsletter. We'll provide regular updates about research and podcasts and information that we're promoting through the website. If you're also interested in identifying your potential causes of depression or anxiety, I've developed a questionnaire known as the IDECU. Now, this is a 130-item questionnaire that helps you identify what your specific or personalised causes of depression or anxiety could be. Now, by identifying this, then you can work towards targeting those particular areas, improving those particular areas that you need to kind of work towards. Now, there's small cost associated with the IDECU, but it comes up with a really nice user-friendly report that will help guide you and maybe also be useful if you're seeing a therapist to kind of share that with your therapist. So check out this website, check out this article, and as I said earlier, be sure to subscribe to our newsletter. Thanks a lot.